Medical masks or cloth masks. With the pandemic in our lives, the use of face masks became an everyday necessity. You put a mask on because you want to protect others and yourself from the infection. In the 16th century, black doctors used to wear glasses and a facial mask with long nose full of fragrant herbs in the belief this was protecting them. The first medical masks consisted of 1 or 2 layers of gauze. They were already widespread in the late 1920s. Nowadays, the majority of masks used by healthcare workers are disposable masks in 3 layers of non-woven fabric, normally called medical masks. However, cloth masks are also often used. They are generally made of 2 layers of cotton and are washable and reusable. Which of the 2 types of masks, though, is more effective in protecting healthcare workers from infections? We could answer this question by doing laboratory tests. These tests are useful, but they are unable to answer our question. In fact, a mask could be more effective in filtering small particles, but it could also allow a high quota of infections for unknown reasons. The only way to answer the question we asked ourselves is to do a clinical study comparing the 2 masks. The most reliable clinical studies are the randomized controlled trials. In this type of studies, treatments are randomly assigned to patients. Were there ever any randomized studies that compared the 2 masks? In the medical literature, we find only 1 randomized controlled trials comparing medical masks and cloth masks. This study was published in the British Medical Journal in 2015. It was conducted in 14 hospitals in Hanoi, Vietnam. The research team was composed by Australians, Vietnamese and Chinese and led by Professor McIntyre. 74 hospital wards with 1607 healthcare workers were randomized to 3 different procedures. They were asked to use medical masks or cloth masks at work for 4 consecutive weeks. There was also a control group that consisted on usual practice, which included medical masks or cloth masks or both. Consequently, data from this group would be taken into consideration. At the end of the 4 weeks, the researchers observed if the healthcare workers developed clinical respiratory illness like cough or cold, or influenza-like illness with fever, or laboratory-confirmed viral respiratory infection. Various strains of coronavirus were also searched. Let's see the results. Respiratory illness was developed by 4.8% of healthcare workers that wore the medical masks, and by 7.6% of the healthcare workers that wore the cloth masks. The relative risk was 1.57, meaning that who wore the cloth masks developed 1.5 times more respiratory illness than the medical mask healthcare workers. However, the result was not statistically significant, as such a difference can easily be achieved by the effect of the chance. The results regarding influenza-like illness with fever were different. The illness was developed only by 1 healthcare worker in the medical mask group, 0.2%, and by 13 healthcare workers in the cloth mask group, 2.3%. In this case, the relative risk was over 13, implying that who wore the cloth masks developed 13 times more influenza-like illness than the medical mask healthcare workers. The result was statistically significant, as such a difference cannot easily be achieved by the effect of the chance. When it comes to laboratory confirmed viral respiratory infection, viruses were found in 3.3% of the healthcare workers of the medical mask group and in the 5.4% of the healthcare workers of the cloth mask group. The relative risk was 1.66, and the result was not statistically significant. In conclusion, although a noticeable difference has only been demonstrated for influenza-like illness, the use of medical masks rather than cloth masks seem more prudent, according to the results of the only randomized controlled trial that has ever been conducted.